Long mean green dragon. Because Chinese, they believe that dragon is the animal that govern the water, the rain, That's why Xiao Qing Long mean the dragon that govern the water. Why govern the water? Because of the lung and also up the abdomen. This formula is very, very famous formula. Because for chronic cough, due to this water retention of lung, this formula is very, very useful. My village last time a few fatal cases, high fever, sent to hospital, then they sent to the icon room, then they died, died. I think 2 to 3 cases. That's why in my village, when they have a high fever, they dare not send to hospital. They send to my father,
Better.
My father using herbs to reduce this thing,
What Dr. Lim is teaching us, that something that's just as simple as vegetable, the spices that we have in our kitchen can become a pharmacy to help you heal yourself.
Before we begin, we would like to share a quick disclaimer. The content presented in this program is intended for informational and academic purposes, particularly related to the history and theoretical understanding of traditional Chinese medicine. It is not meant to replace professional medical advice, diagnosis, or treatment. If you have any medical concerns or health conditions, please consult your physician or a qualified traditional Chinese medicine practitioner. Please do not ignore or delay seeking professional medical advice because of something discussed in this program. Your health decisions should always be guided by a qualified healthcare professional.
So good morning, everyone. Welcome to our series class.
I'm here. Good morning.
Good morning. So our class is already set. Almost 44 people are in the classroom.
Yeah, that's good.
So as we continue our study, Doctor, on the Shang Han Lun, we have been studying this. We'll take the next set of verses for today. So give me 1 minute. So Doctor, today's verses will be 41 to 50.
Okay.
So let me start reading with your permission.
Yeah, please proceed now.
So in exogenous disease, when there is water chi congested below the heart with coughing and slight panting, fever without thirst, if after taking the decoction thirst appears, this means the cold has been dispelled and the disease is about to resolve. Then Xiao Qilong decoction governs this. Formula 11.
Yeah. Now, this qi here means energy,
Okay.
Water congested below the heart. Below the heart means upper abdomen. How do you know that there's water congestion? First, coughing, When the water is in the lung, it causes coughing and panting. Okay, coughing and panting is a sure sign that there's water retention inside the lung. Okay, then for the upper stomach, bloating, bloating and sometimes with nausea. Okay, now here is very important. That fever without thirst. Fever without thirst, that means there's no dehydration. Fever with thirst, you have to suspect dehydration, which is opposite to water retention. Okay, so if after taking a decoction, no thirst appear. Okay, that means they already removed the water, Okay, that thirst appear. That means the cold has been dispelled. Okay, then it's about to recover. This is a good sign.
It's a good sign.
You see, when the water retention, there's no thirst. After you remove the water, then the thirst appear. Actually, it's a good sign. That means the balance back, Then xiao means small. Qing Long means a green dragon. Because Chinese, they believe that dragon is the animal that govern the water, the rain, That's why Xiao Qing Long means the dragon that govern the water. Why govern the water? Because of the lung and also up the abdomen. This formula is very, very famous formula. Because for chronic cough, chronic cough due to this water retention of lung, this formula is very, very useful.
Okay. So, Doctor, to summarize, we understand that water congestion, if it's in the lung, coughing and panting are the two signs that we will see.
Yeah, yeah.
Then, if it's on the upper stomach area, then bloating and nausea is what you can see.
Yeah,
Uh,
bloated nausea, yeah.
yeah, and
And
when
sometimes we can hit the stomach,
yeah, by
and listen to the sound.
yeah, tapping the stomach, you can actually
Tapping
know
the sound.
whether it
Yeah,
is filled with air or filled with water.
yeah. If air, it give you a drum sound.
Drum sound.
Then if water, give you the dull sound.
Yeah, dull sound. Yeah.
Yeah, yeah.
Then
We can know.
this is a very good sign that you have fever without thirst. That means there is enough water in your body. That is why you
Yeah,
don't
yeah,
feel thirsty.
yeah,
And
yeah, yeah.
when you have taken the right dose of the Xiao Qing
Chao Xing
Long,
Long, yeah, yeah.
then that means that when the water is eliminated and you feel thirsty, that means your treatment is good.
It's a good sign. It's a good sign.
Fantastic. Okay.
Yeah, 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 yeah.
Yeah. Next slide.
Next, yeah.
In EXO-ing disease, when the exterior signs have not yet resolved and the pulse is floating and weak, it should be resolved by sweating. Quitcher decoction is appropriate. Then
Yeah.
there is a formula of Quitcher shower.
Yeah, 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 yeah. I think the
Yeah,
formula you all can
is
go
yeah.
and read into
They
that.
can read themselves.
Okay.
Yeah.
Only thing is that you see the key word is that floating and weak.
Hmm.
When you touch a pulse, softly, then you can feel the pulse and it's weak. I mean the metabolism is weak,
Hmm.
Then the cinnamon is good.
Hmm.
Cinnamon is good.
Okay.
Uh,
After a short while, sip one sheng with hot thin rice gruel to assist the strength of the medicine. Obtain a slight sweat. So,
so,
doctor, here,
there's some spelling mistake, It's not 字母 干燥, it's a 字干草,
which one,
remove the
doctor?
mu. Yeah, the Nicolaites.
Okay, okay, okay.
It's not 字母 干燥. And also 大枣, no, ZAO, not JAP.
Z
Usually
A O.
JAO, yeah, yeah. I
Okay.
think this formula is quite standard,
Yeah.
Quite standard. Yeah,
Yeah.
yeah, yeah. Quite
Okay.
standard. Yeah, yeah.
Next slide.
Next slide, yeah.
In the exo-in disease, if after purgation there is slight panting, this is because the exterior has not yet resolved. Quiche decoction plus
Upo,
hopo, and Xingqi
stringent.
uh, governs this. Formula 13.
Yeah, you see, when you push, no, when
Uh,
you push now, you push the energy down.
hmm.
Okay, but the exogenous problem is still there, no.
Uh,
Okay, then the body will push it forward to counter
yeah.
it, no. That will always cause asthma,
Okay.
and cough, no, asthma
Mhm.
and cough. Okay, then in this case they use the magnolia bark.
Mhm.
Okay, and also this what do you call apricot kernel,
Mhm.
apricot kernel. Okay, in the absence of what do you call magnolia bark, you can use fennel,
Hmm.
or coriander seed.
Hmm.
Fennel, coriander seed, I think is you use it in the cooking, no?
Yeah.
Okay, then this apricot kernel is easily available
Easily available. Yeah.
in supermarket.
Doctor,
I think in India it should be easily available.
available,
I think.
available,
Yeah,
available.
available. Yeah, even in Europe and many because this is it's very similar to almond.
Yeah.
It's very similar to almond, but almond are bigger size.
Hmm.
Almond bigger size, and this apricot kernel a little bit bitter. Sometimes we
Uh-huh.
also call it the bitter apricot. Okay, then we blend it into powder. Okay, then it's very good to replace milk. Then it's good for cough. Apricot, you see, cough is a very common phenomenon.
Yeah.
Okay, so sometimes when a cough is due to water retention, this apricot kernel is very good.
Fantastic. Doctor, one
Yeah.
logic I understood here is when during the exogen, when the exterior has not yet resolved, the condition is not resolved, and one gives purgation, means he's
Oh,
trying to push,
wrong.
then
Yeah,
the
yeah,
body is trying to resist and go upward. That is why you have panting. Is that
yeah,
so?
penny. Yeah. It's so, it's
Ah,
so.
understood.
This quick doctor, they simply push, no.
Mm-hmm.
Then they push, then the patient have a water retention. The water push up, Then the
Mm-hmm.
lung are full of water. Then they started panting.
Oh.
Okay, and also coughing,
Mm-hmm.
Yeah, this is quite common when due to the wrong treatment.
Okay. Let's
Yeah,
take the next slide.
yeah.
Yes. Then we have the formula which we will be sharing with everyone. We will be giving
Yeah.
you the
So
content.
when the student have time, please study that.
Yes.
Yeah. Yeah. Yeah.
Okay. Next slide. Okay. Notes for exogenous disease. Purging is a wrong
Wrong
treatment.
treatment.
For all exogenous disease, doctor.
Yeah, you should not push for
Okay.
all. So when a person have aversion to cold, have headache, oh, never push, no.
Never purge. Wow.
Yeah, headache and joint pain, don't push.
The very
You
important
you
lesson.
push only when they are having this
Ah.
constipation, and also have a strong fever,
Hmm.
constipation, you know. So when a person the stool is normal, never push.
Yep. That's a great lesson.
Yeah, 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 yeah.
In
Exogen.
numbers 44,
Yeah, yeah.
exogen disease, when the exterior signs have not yet resolved, purgation must not be applied. To apply it is a wrong treatment. If one wishes to resolve the exterior, the Guiche decoction is appropriate. Means
Yeah.
rather than doing purgation, use Guiche.
Which is yeah, cinnamon.
That is much better.
Cinnamon is a tonic, you know.
Uh-huh.
It can boost the metabolism.
Yep.
And it's very good for depression also.
Mm-hmm.
When a person metabolism is weak, they also a lot of depression. So I
Doctor,
also
when
use it to treat the depression. You know, many
ex-
women, yeah, after especially after this birth, no, this postnatal depression is a quicker decoction is very good.
Dr. Exoin, basically when the metabolism is low,
Low, low, low.
what are the mental like other than depression? What are the
No, they
mental
become
signs?
quiet. No, the person
Okay,
become
become
quiet,
uh,
depressed. He doesn't
uh,
want to talk. Okay,
uh,
then the movement become
low, uh,
less. Then check the pulse.
pulse.
The pulse always weak.
Hmm.
Then check the tongue. No, tongue also pale.
Hmm. Hmm.
So no, this is a common sense. No, you can check all these things.
Yep.
Yeah,
Okay.
yeah.
Next slide.
When a person is talkative, very
Is
agitated, no, then
young.
extra young. Yeah, yeah, yeah.
Ah. In exoing disease, if sweating was first induced and the condition did not resolve, and purgation was then applied again, if the pulse is floating, it will not heal. Floating indicates that disease is on the exterior, yet purgation was wrongly applied instead. Therefore, it did not heal. Now, the pulse is floating, thus, it is on the exterior. One should resolve the exterior and then it will heal. Quitzer decoction is appropriate. Notes here the sweating is due to wrongly
Wrong
applying
person, Ma Huang.
tongue,
Yeah, yeah.
yeah, which is a wrong treatment for exoing, where the metabolism is weak. Yes, doctor.
When the metabolism is weak, you don't use ephedra, no.
Hmm.
Don't use Ma Huang. You further reduce the metabolism
Hmm.
because Ma Huang is cold, you know. It further reduce the metabolism. Okay.
Hmm.
Now, when you say sweating, also you have to sweat it rightly, you know.
Hmm.
This is quick one is called warm sweating.
Hmm.
We're using warm herbs to sweat to boost the metabolism. So when you use a cold herb to sweat, like using ma huang or using this peppermint, then the disease may not heal.
Doctor, can you explain me this logic of how cold herbs also can cause sweat?
No, yeah, certain cold herb can like I say mint, peppermint is
Mint.
a cold herb. It can cause sweating.
Oh, it causes sweating. Okay.
That normally for this fever, no,
Mm-hmm.
for this fever with dry skin.
Mm-hmm.
People with dry skin, they have this water congestion,
Mm-hmm.
in the lung or in the stomach. When we say flu, there's so many types of flu, There
Mm-hmm.
are lungs flu, there are stomach flu, there are this uni bladder flu, there are also colon flu, and also this muscle flu. 5 types of flu. Okay, for lungs flu, we always use ma huang.
Mm-hmm.
For stomach flu, we always use gui shi,
Mm-hmm.
Then for this urinary flu, we're using this poria to induce the urine. Then for this colon, okay, colon also we use this they want to all this gherkin, to
Mm-hmm.
regulate the this thing. Okay, so different flus we use different medicines.
Doctor, now you just said dryness of the skin is also possible due to water congestion.
Yeah, water congestion of the lung. Then
Yeah.
the skin become dry.
Okay. And at that time
No,
we can.
it's actually your body try to because your body feel to to discharge the water. That's why the water return in your lung.
Ah.
You see, why you are dry skin? Because you fear to sweat, no?
The you mean the channels are blocked. That is
Yeah,
why.
yeah, channel block, yeah. The
Ah.
block, the pore block, no, then the water cannot go out.
Oh.
So when the water cannot go out, it go into the lung and go into the stomach.
So at that time, doctor, the patient will have fever, but he will not
Oh,
have
they have
thirst.
cough. They have cough.
They have cough.
Fever,
Yeah.
cough, painting,
Hmm.
nausea.
Wow. Logical.
Then this ephedra is good.
Okay. 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 Okay.
Yeah, yeah, yeah.
Yeah.
No, you
Next.
see, one, no nausea, no.
Hmm.
No painting.
Understood.
When cough, you don't use 桂枝汤.
Hmm.
Cough, the mean the water retention, then you have to use peppermint.
Hmm.
You use peppermint or you ephedra.
Yeah.
Here they say the sweating is wrongly used.
Hmm.
Instead of using 桂枝, they're using ephedra. No, then the disease may not
Hmm.
you see when the metabolism is low, you're using ephedra, you even
You
further
put
lower your
low,
metabolism.
more low. Yeah.
Yeah, then you cause cough. You cause cough and this chronic cough.
Hmm.
You see, there are many wrong treatment. You can always see in the clinic. They
Hmm.
cough for a long time.
Hmm.
Yeah, this is wrong due to the wrong sweating.
And doctor, a good doctor, when he sees that his medicine is aggravating the symptom, he should stop and he should change the
Yes, to
medicine.
stop the mean the wrong treatment. You should
Yes.
not apply wrongly.
Yeah. Do not
Yeah, yeah, yeah.
force.
Yeah.
Okay.
Then no, the basic principle, the metabolism is weak. We use cinnamon to boost the
Yes.
metabolism. As
Yeah.
simple as that.
Simple. Correct.
Yeah, yeah, yeah.
Next slide.
Proceed, yeah.
In Yang disease,
Yeah.
the pulse is floating and tight.
And tight,
There is
yeah. No sweat, no sweating.
no sweating, but fever with body pain.
Uh,
And after 8 or 9 days, it has not resolved. And exterior signs are still present. One should induce sweating. After taking the medicine, if the condition is only slightly relieved, the patient may develop vexation and closing of the eyes. In severe cases, there will certainly be nosebleeds, and nosebleed then brings resolution. The reason
yeah,
for
yeah.
this is that the yang energy, chi, is excessive.
Yeah,
Here,
yeah.
Mahawang decoction governs this. Yes,
Yeah.
doctor.
You see, the thing said, the tight, there are two things very important, no. Floating and tight.
Hmm.
Okay, like the guitar string, no.
Hmm.
When you hold a guitar string, then dry skin.
Hmm.
Okay, then the fever, body pain. Okay, this is a very serious case, no. So even though you address it lightly, okay, there's still some bleeding of nose bleeding.
Hmm.
When nose bleeding also, they mean the kid go out, then the patient may heal. So when you see nose bleed, don't feel alarm, no. It's a
Hmm.
good sign. This is a very serious exoyoung problem. So even you address it rightly. Okay, the disease do not just cured instantly.
Hmm.
It takes 7 or 8 days,
8 days.
to recover.
Okay.
Then sometimes the nose bleeding.
Hmm.
Actually, when a patient is having exoyoung, if the nose is bleeding, normally the fever will subside.
Hmm. Because the
And
chi has been reduced because the energy that
yeah,
was
yeah. I saw in one documentary, in Africa, they even purposely using some gases, to stimulate the nose to bleed
bleeding.
to
Oh,
treat disease. But of course, we don't do that,
oh,
Let the body do it naturally.
naturally.
You
Yeah.
don't induce nose bleed. No, no, don't do that.
Hmm.
Yeah. So Ma Huang is very good.
Okay. Yeah. Next slide.
Yeah, in the absence of Ma Huang, can use peppermint plus black pepper,
Hmm.
With peppermint, the problem is that peppermint do not remove the water retention of the lung.
Hmm.
That's why we put in the black pepper to remove the water.
Hmm. Hmm.
Okay, sometimes radish also can.
Hmm.
So you cannot use the peppermint purely to replace Ma Huang,
Hmm. You need
You
it
should
with
you should
pepper.
you should with peppermint. No, sorry, you should with this black pepper or with radish. Okay, to remove the water retention.
And Doctor, black pepper is basically hot. So with peppermint cold, it will manage itself.
Yeah,
The
yeah, manage itself. Yeah, yeah,
yeah,
yeah, yeah. You should check the peppermint. Peppermint
yeah.
something too cold,
because
Okay,
it's
it's set.
already exo yang, and if you
Yeah,
still
yeah,
give
yeah, yeah,
peppermint
yeah.
alone is not,
Yeah.
sorry, you cannot give black pepper alone directly. You
Yeah,
need
yeah, you cannot be
uh,
prevalent.
uh,
It will make the person thirst, no,
yeah, more thirsty,
and agitated.
agitated, more agitated.
But you use peppermint.
Yeah, understood.
Or radish also good. Radish also
Mhm.
good. Yeah, yeah, yeah.
Doctor, 47, verse number
Yeah.
in exo-yang disease, when the pulse is floating and tight, with fever and no sweating of the body, spontaneous nosebleed indicates recovery. Oh,
Yes, yes,
it's a
yes.
sign of recovery. Okay.
Yeah, yeah. So you as a doctor don't get panic,
Huh.
when you see the nose break.
People
It's
get,
a body defense system to remove the heat.
many people actually get scared when they see blood
Yeah,
coming
you
out
get
of the.
scared. No, no, no need to get scared. Is a good sign.
Okay, great, great. Okay,
Sometimes
next.
vomit also is a good sign.
Vomiting, even
Yeah,
sometimes
vomiting.
purgation. Purgation is also a good sign if it does it naturally.
Yeah, yeah, yeah. Sometimes is a vomit also. All the heat will come out.
Yeah, yeah, doctor. Next we go for
Yeah, yeah,
48,
yeah,
verse number
yeah,
48.
yeah.
In dual yang disease, when exo-yang first contracts the illness, sweating is induced, but the sweat comes out first and is not thorough. It then transfers to endo-yang, and continues with slight spontaneous sweating without aversion to cold. If exo-yang disease signs have not yet ceased, purgation must not be applied. To apply it would be a counter reaction. In such a case, slight sweating may be induced. If the facial complexion appears evenly and distinctively red, the yang qi is constrained and depressed in the exterior. It should be resolved by fumigation, heat smoking. If the sweating is not thorough, it is insufficient to treat the disease. The yang qi is constrained and depressed and cannot be released. When sweating should occur but does not, the patient becomes restless and agitated, does not know where the pain is. At times in the abdomen, at times in the forelimbs, on palpation, it cannot be found.
Yeah. You see, when exo young and endo young are together,
Hmm.
okay, pure pure sweating is not good,
Hmm.
Pure sweating, you have to sweat thoroughly. Sometimes the sweating are not thorough, okay. Then internally you have to use gypsum,
Hmm.
or you have to use this pearl powder or mother of pearl to
Hmm.
remove internally. You don't do that, okay. Then the patient will be uncomfortable.
Hmm.
Okay. Then worse if they use purgation.
Hmm.
Okay, so all these are wrong treatment, So when a person is having exo young and also have endo young, I mean, what do you call, uh, without without
Without chill.
without chill,
Ah.
Without chill, you have to be very careful.
Hmm.
Then you need to apply gypsum. I mean, the lips are normally are very very red, reddish, Then the person have become very agitated.
Hmm.
Okay, then you use the gypsum, or we are using this a pearl powder,
Hmm.
or this mother of pearl, to what they call, to treat it. This pearl powder, mother of pearl in Malaysia is easily available.
Hmm.
When we go to the thing, I don't know about other part of place, but the extent we are selling it,
Hmm.
the pearl powder. Okay, so we can use that. This case is a complication. I mean, they are exo young and endo young appear together.
Hmm.
Okay, so normally we treat the exo young first
Doctor,
by
what is it
induced sweating.
by saying heat smoking? What is fumigation?
Yeah. Now this is this the way is that they put what they call, they put a patient on the bed,
Hmm.
then they set out the fire below the bed,
Oh,
Okay, this kind of fumigation. Normally they do it during the winter.
okay.
Normally in tropical country we never do that.
But doctor, here the facial complexion is already evenly and distinctively red. Even the yang is on the exterior side is like the patient is already high. Wouldn't this cause any complication by fumigation or increasing the heat of
Yeah,
the?
yeah,
Exactly, yeah.
yeah, yeah.
Because then, doctor, if the sweating is also not thorough, then mean now here both young, the
Fumigation to induce sweating.
okay.
Like sauna, it's the same as sauna.
It's sauna,
Yeah, sauna. Okay, this a thing. But normally we don't do this in
better not do,
modern. We never do that. this sauna is very risky, Because a person is already fever, you sauna him,
Exactly.
he may faint,
Yeah.
He may drive him into coma.
Mm-hmm. And
Because
doctor
the
here,
problem, Shang Han Lun, the problem is that it had been disturbed, by the wall. Then it's corrected by the student.
so there is add-on, doctor. There is also add-on.
So this one look like add-on.
Oh,
Because this one is not it doesn't look like
logical.
because Chang Chongjin, he's very concise.
Yeah.
He do not talk so much. So we suspect that this one is by his student, not
Huh.
by him.
Okay, okay.
So fumigation, you just ignore it,
Ignore
We,
it. Okay.
so we don't do that.
Hmm. Okay, then here, doctor, why is this that when sweating should occur but does not? The patient becomes restless. Why is he restless and agitated? Because of the yang
No,
energy,
you
but
see, you see, when hearing this exo young, you should use ephedra to sweat it,
correct.
That's why you do not use ephedra, you use quichi instead.
Hmm.
Then the sweating is not thorough. Wrong
Hmm.
treatment. Wrong treatment.
Correct.
Okay. So when you sweat also, you should sweat accordingly,
Hmm.
When the metabolism is weak, you boost the metabolism.
Correct.
Warm sweating. So when the metabolism is high, you should use cold sweating.
Doctor, here then I can use mint.
Yeah, I can use peppermint.
Yeah. Okay. Okay.
Radish also can use.
Radish can also be used. Okay.
Can use peppermint also can use. Radish also can use.
Okay. 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 Understood. Okay.
Sorry.
So I think the student need not worry because this is a slow learning. We'll have to first day we don't understand, but over a
Yeah,
period
yeah.
we'll keep on reading. We'll
So
understand.
remember, wet skin using
Yeah.
quicker, dry
Uh,
skin and with cough, using ephedra.
Ephedra.
Ephedra is not around, then using this peppermint plus black pepper.
Hmm.
Yeah, yeah. Continue. Yeah.
Yeah. Next slide. The patient has shortness of breath and only sits. This is because the sweating was not thorough. Inducing sweating again will lead to recovery. How do we know that the sweating was not thorough? It is known because the pulse is rough. Now
Yeah,
here,
the
doctor.
pulse is not regular.
Rough means not regular. Okay.
Irregular, yeah. The pulse because erratic,
Mm-hmm.
Yeah, yeah, yeah.
Okay. Notes, this is the Dachi long tongue, that's a major green dragon syndrome. For example, acute influenza or pneumonia, where
Pneumonia.
strong induction of sweating is necessary. But instead, the doctor just induced the sweat weakly using the Mahawang or Quichitang, which is not sufficient to induce the sweating to treat the disease. The wrong treatment sometimes lead to the heat to travel inwards and resulted in endo-yang disease with slight sweating and no aversion to cold.
You see, for example, when this acute influenza or acute pneumonia, they
Hmm.
have very high fever and very strong chill, high fever, strong chills, and very, very agitated, Okay, then this major green dragon is a very effective this thing. It will cause excessive sweating
Hmm.
because this is a very serious case. So if you use ma huang or you quizzes not enough,
Hmm.
the sweating not enough. Okay, how do you know that you need aggressive sweating? Is that okay? It's a very strong chill,
Hmm.
strong chills and vexation and the patient is very very agitated
Hmm.
and he's not cannot sit quietly,
Hmm.
they I give you one example, one doctor, he said he treated one case, one fisherman,
Hmm.
when the day are very heat, very very the weather very heat is sweating, then he jumped into the river to catch a fish.
Hmm.
Then after that, they go back, he developed very high fever
Hmm.
and a strong evolution of a chill, Okay. Then when the doctor induced using ephedra, it's not effective.
Hmm.
So he had to use this major green dragon decoction, okay, to strong induce the sweating. But you have to be very careful, when you apply this thing, never use it too frequent,
Hmm.
It will cause dehydration and sometimes can be fatal. Some case dead,
Mm-hmm.
to over induction. That's why when the sweating cannot be stopped, then immediately you have to use the thick cinnamon decoction,
Mm-hmm.
sini, and dry ginger. Drink to stop the sweating.
Doctor, here my one question is now here when we see that acute influenza and or pneumonia, these are the conditions which when people get, they are usually in a hospital setting which is already cold. So rather than inducing sweat, they are put into an environment which is going to prevent sweating. Is that
Uh,
risky?
no, risky. The patient
Very
may die.
risky.
The patient may
Oh,
die.
oh.
You have to remove the kid, no. Instead, you steal the pole, no. The the
Ah,
the patient may drip into coma, no. We have seen a lot, and they die. Even in my village, no, it happened before. They go to hospital, they put into air condom, then the patient died.
yes.
Died.
My goodness. Okay.
So that's why we say that even this ancient knowledge, no, is also important, It doesn't
Yes.
mean that you go to the modern hospital, everything will be okay. Not
Correct.
necessarily. Yeah, yeah.
Yep. Next slide, please.
Because when they say that a high fever,
Hmm.
then they put a very strong aircon.
Aircon. Yeah.
Nah,
18
nah,
to
nah. The
18 degrees,
the the
doctor.
the the, 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 air, the cold air steal the pulse even more, no?
Ah.
Then the kid was locked inside the body, then the patient died. My
Hmm.
village last time a few fatal cases, no. High
Hmm.
fever, sent to hospital, then they sent to the icon room, then they died, died. I think 2 to 3 cases.
Hmm.
That's why in my village, when they have a high fever, they dare not send to hospital. They sent to my father,
Better,
Then my
better.
father using herbs to reduce this thing, yeah.
Okay. And verse 49.
Yeah,
When
yeah.
the pulse is floating and rapid, by principle, sweating should be induced and recovery will follow. If purgation is applied wrongly instead, and there is heaviness of the body and palpitations of the heart, sweating must not be induced then. One should wait for spontaneous sweating and then it will resolve by itself. The reason for this is that the lower chi position pulse is faint, indicating interior deficiency. When the exterior and interior are both weak, the fluids will harmonize on their own and the spontaneous sweating will occur, leading to recovery. Doctor.
Yeah, when the wrong treatment, okay, then the purgation is applied.
Hmm.
You don't simply take the patient, let him take rest.
Yes.
If you try to interfere with him, then it may even what do you call? It may even harm him further.
Hmm.
Then when you take the pulse, there are two positions. Okay, let me see better. I can show it in
Yeah.
three finger,
Yeah.
yeah, yeah, three finger.
Three finger.
So the what do you call? The top one is chun inch.
Which one? The one? Yeah.
Now three finger,
Yeah.
three finger. Okay, this one is the one near to the thumb.
Near to the thumb. Okay.
It's chun. Chun mean inch.
Uh-huh.
Then this one further away from the thumb.
Uh-huh.
Che mean foot.
Mhm.
Okay. So this one is the ex, is a exogenous problem.
Okay.
Okay. This one is a endogenous problem.
Mm-hmm.
This one is the intero.
Ah.
Okay. This thing. Then for the pulse, from 3% of pulse, you can know the body condition.
Mm-hmm.
This one you need training, When
Mm-hmm.
next time when we come to the Sunya practice,
We will
then
teach.
we have to train. We
Yeah.
just by description of this it doesn't work.
Correct.
Okay, the thing. But you can feel it, Okay, if both the top and bottom pulse, if they are weak, they mean the body are very weak. Better don't disturb the patient, Okay,
Mm-hmm.
let him take rest, recover by itself.
Wow. Yeah. Understood. Yeah, so here there is a way in which the body can recover itself. So when the pulse is floating, doctor, next verse 50th, the last one for today. When the pulse is floating and tight, by principle there should be body pain and it is appropriate to resolve it by sweating. If hypothetically the lower pulse, that's the chi position, is slow, sweating must not be induced. How is this known? Because the nutritive energy, chi, is insufficient and the blood is scant.
Yeah, you see, very important, When the pulse is floating and tight,
Huh?
By that is have body pain, you know.
Hmm.
Okay, now this patient, he do not have body pain.
Correct.
Okay, then the lower pulse weak, you know. Okay, that mean is body fluid is insufficient.
Correct.
Then the blood is insufficient.
Ah.
You don't induce sweating, you know. Induce sweating, you call dehydration, you know.
So logical. Yes.
So when the lower pulse, when the lower pulse weak, okay, and the body do not feel pains,
Hmm.
then is dehydration.
Doctor, pain in the body is a sign of obstruction, but there is fluid in the body.
Yeah. Pains normally is water retention.
Water retention.
Pains and heaviness.
Heaviness of the limbs,
Yeah.
heaviness of the body
So
is water.
when it dehydration, normally it's a dry skin.
Ah.
Then or sometimes they have this thirst.
Hmm.
They thirst and they have this dry throat.
Hmm.
Okay, then dry cough,
Hmm.
coughing without frame.
Hmm.
So these are dehydration. You should never induce sweating.
I think this is a very important lesson, doctor, to differentiate between water retention symptoms and
Yeah.
dehydration symptoms. Water retention symptoms, the same cough, but this cough is not
Yeah, the
dry
cough with phlegm.
phlegm. But
With
when it
clear
is
phlegm. Then also
dehydrated,
panting now.
panting.
Panting,
Ah.
panting. Panting is a very, very strong indication of water retention. Okay. Then stomach is bloating,
Hmm.
nausea.
Correct.
Yeah. This is the thing. So if there's no nausea, no panting, you know, the dry cough, okay, the dry skin, okay, no body pains, then you should suspect dehydration.
Hmm. Yeah, I think that's very clear.
Dehydration, yeah.
Very clear.
See, to check whether it's hydration or dehydration is very important, you know,
I think that
as
is
a
the
doctor.
key, doctor. Here, Chang Chung Chung is pointing us towards that the hydration and dehydration are the two important things because
Yeah.
either you're purging or you're sweating because your line of treatment is also with the water itself, right?
When hydration, you can cause sweating.
Correct.
When dehydration, no, never sweat, you know.
And don't even purge.
This is common sense, you know. If
Hmm.
the body already lack of food, you go and sweat him, he die, you know.
My goodness.
No,
Yeah.
no, die. Be careful of factor, you know. When a person is suffering for dehydration, you use da qing long tang, die, no. Many cases die, many cases. That's why when we study Shang Han Lun, when come to da qing long tang, the what they call the teacher always caution, no, be very careful.
Hmm.
Okay, so when the pulse is weak, don't use da qing long tang, no.
Hmm.
When the
Hmm.
pulse weak normally is also indicate you suspect dehydration also. Low in metabolism or low in fruits.
Yep. I think very clear. This.
Yeah. So all these are common sense, no? All
Yes.
these are
Yes.
common
Yes.
sense. Yeah.
But so, doctor, this is the end of today's 10 verse. No, from
Okay.
Doctor, from Shang Han Lun, I also learned that even the wrong treatment he's explaining, Chang Chung Ching is explaining, this
Yeah.
is wrong. Don't
Yeah.
do this. And this is right. Please do
No,
this.
he discussed a lot about wrong treatment.
Yeah.
That's the thing. He is a great teacher, no?
Yeah.
Not only the positive one. Okay. Then thank you very much.
Thank
See
you,
you again
doctor.
next week.
Yeah.
Okay.
Thank you so
Bye bye.
much. Yeah. Bye bye.
Thank you very much. Bye.
So, thank you, class, for attending another great session. Your sincerity praise waved for our better learning. Make sure you keep your notes, keep your questions, but put this into practice because what Dr. Lim is teaching us that something that's just as simple as vegetable, the spices that we have in our kitchen can become a pharmacy to help you heal yourself, not just dependent on modern medicine and the dependent on the the science that is still evolving to find ways to heal some of the diseases that from last 2500 years have already been taken care of by the great physicians of the past. So with respect to Chang Chung Ching and his Shang Han Lun and our great teacher Dr. Lim, we end today's session. See you next week. Till then, namaste. Bye bye.
This program explores Shang Han Lun for educational purposes only. The content reflects traditional knowledge and personal interpretations and is not medical advice, diagnosis, or treatment. It follows YouTube guidelines and does not promote harmful or misleading practices. Please consult a qualified healthcare professional before applying any information. Seoul, Sunya Open University Learning, is not responsible for any outcomes based on this content.